Guys come all the way from Bangladesh, which is pretty far from where we are. We are right in the southernmost tip of India, and he has already had a surgery for the nose before. So we're planning a revision rhinoplasty today, and his main concerns are that his nose is not projected adequately and it's also wide. So this is going to be an open structure rhinoplasty. I'm going to be harvesting some rib because it's a revision procedure. On the scan, there's a lot of septum that has been worked upon earlier. So I would have to reconstruct that to a certain extent as well. He had also a very significant medical history. आप दवा अभी 5 दिन के लिए बंद करें ना? So he was on blood thinners basically. So our anesthesiologist and the physician advised him to stop that medicine for 5 days. Today is day 5 now after he stopped, and so we're planning his surgery right now. It's probably going to take me around 2.5 to 3 hours, also because patients like this tend to bleed a little bit more when I'm operating. You all know the nose is very vascular, and also he's on these blood thinners, which he stopped, of course, like I said, 5 days before. But still, I'm expecting these kind of procedures taking a little longer. He's also very close to his 6th decade of life, so I would have to make sure I get enough cartilage, little bit more medially than what I would do for another younger patient. Thank you. Take care.
Let's check whether the fasciculation has stopped. I think the fasciculation has stopped. So I am going to put a 8 size ray tube.
About to start this revision nose job. This patient had his primary surgery elsewhere, but is seeking a lot of work now. We're going to do his cosmetic improvement, augment the dorsum, reduce the width of the nose, give him a better tip, better projection. There's the different views. With this revision rhinoplasty, this patient has traveled a long way to come here. He's had his primary rhinoplasty elsewhere. A lot of work on the radix, tip, dorsum, osteotomy, septal reconstruction with rib harvest, and you can see the improvement that we've achieved. We're going to first show you all the different views. Show the basal view. Now we're going to show you some comparison. So we're going to show you how he looked before we started. You can see that nose. You can see how it is right now. A lot of improvement in the entire shape of the nose. Okay, now we're going to go to the other view. And that was before. You can see the flatness, the deviation, all of that fixed. and then the basal view. So we've made it more proportional now to his face. Ingvar. Finished. ओके सर, आप देख सकते हैं काफ़ी इम्प्रूवमेंट है ना। ये जो है कम हुआ है, ये थोड़ा बड़ा हुआ है, लेकिन देखो यहाँ पे पूरा सूजन है। अभी आपका एज भी थोड़ा ज़्यादा है ना, तो इसके वजह से थोड़ा और टाइम लगेगा। और साइड व्यू भी आपको दिखा देते हैं हम। ये देखिए, नहीं सर ऐसे दिखाइए, कंटिन्यू। टिप जो था मतलब काफ़ी कुछ स्ट्रेट हुआ है, और ये जो कलर है ये सब निकल जाएगा। ये स्टिचेस सब भी निकाल देंगे। जहाँ से आपको रिब निकालता कुछ दर्द हो रहा है अभी? थोड़ा सा हो रहा है, ज़्यादा नहीं हो रहा। वेरी गुड। और काफ़ी स्ट्रेट हुआ है, यहाँ से ऑगमेंटेशन हुआ है। टिप को थोड़ा पतला हुआ है, ये नैरो हुआ है, ये नैरो हुआ है, स्लिम हुआ है। जो ऑस्टियोटमी किया है वो सब निकाल देंगे अभी आपको, स्टिचेस सब। ठीक है, ख्याल रखना अपना। दवा मिलेगा, दवा सब ले लेना, ठीक है। ओके, so he's traveled all the way from Bangladesh, and he's already had a surgery elsewhere in another Indian city few years ago. He had problem with breathing. We've sorted that out. He had a big bulbous nose, difference between the dorsum and the tip. We've done a rib augmentation. I've tried to straighten that out. We've done the augmentation, we've slimmed it, and this is after day 8. So we just have to remove the sutures and everything. आप लोग आप कब जा रहे हो? कल सुबह जा रहे हो? अच्छा।